Es geht die bestmögliche Betreuung der Spieler, dass sie fit bleiben.
It's about providing the best possible care for the players, so they stay fit. And about the preventative aspect, it's always best not to have any injuries. And when there's been an injury, about the best possible, the fastest possible recovery and care, which runs through different phases.
Großes Vertrauen eingespielt.
The most important things, in my opinion, are a high level of trust and a well-drilled team.
Mein Name ist Peter Üblacker.
My name is Peter Ubelacker. I'm one of 2 orthopedic surgeons responsible for orthopedic and trauma surgery, treatment and care of the Bayern Munich players.
My name is Dr. Jochen Hane.
My name is Dr. Jochen Hane. I'm one of the team doctors at Bayern Munich, and I am responsible for orthopedics.
Wir treffen uns 2 Stunden vor Training.
We get together 2 hours before training starts when we have a big meeting. All the athletics coaches and physiotherapists are present, as well as one of us orthopedic surgeons, in most cases also Professor Olin Schmidt and an assistant coach, so that he can also pass on the relevant information to the coaching staff.
Dort wird jeder Spieler
Every player is discussed in detail there.
We discuss what he was able to do the day before in training, what he'll be able to do on that day, what problems are there, how did the treatment go.
In dem Moment hat jeder
At the moment, everyone sitting in the auditorium has the opportunity to say something if he thinks it will have an impact on the daily routine.
And together we also discuss what the player will likely be able to do that day. After the meeting, which usually lasts from 15 to 20 minutes, the players start turning up, and the ones carrying knocks will of course be particularly looked at and also treated.
natürlich so, dass wir schon auch
It is, of course, the case that we do have our concepts in mind, but in terms of the workload, we simply also try to plan the day according to the individual situation. And in that respect, it's simply crucial that we communicate well with each other. But I have to say, I think we have a top team at the moment. Peter and I have 100% trust in each other. That's why we always take turns. And then it's about communicating with the athletics coaches and physiotherapists. And I think we have a very, very good setup at the moment. That's definitely essential.
Then they go off to training. We come here into the practice. We have external patients who are not part of the FC Bayern, but if anything happens in training or any treatment is necessary after the session, we can be over there as soon as possible, or the players can be here. And if an accident or serious injury occurs, we have every facility available here, including imaging, to examine and treat them immediately.
Das ist schon essentiell.
And we are, of course, extremely privileged to always have all these possibilities here on site at Säbener Straße,
an der Säbener Straße vor Ort haben, inklusive
including MRI, X-ray, and CT diagnostics. The cooperation with the radiologist is also really excellent.
Lucas, what do you think of Jochen?
He's a terrific doctor. He's my bro.
Mein Brudi.
Auf jeden Fall.
Definitely.
Mein Brudi vor allem. Normalerweise kommen die Jungs zum Tapen, dann
Normally the guys come in for taping, then they're fine-tuned from a biomechanical point of view. They go to warm up, come back a quarter of an hour early, and then head out onto the pitch.
hatte sich nur in die Leiste gefasst, deswegen habe ich
He just grabbed his groin, which is why I thought,
No, just a knock.
okay.
He trains well, you have to say.
Auf dem Platz ist es eher so, dass wir da
On the pitch, it's more a case of relying on examinations, on our examination results, on our hands, and of course a lot of talking,
wenn es nur 10 Sekunden mit dem Spieler sind.
even if it's only 10 seconds with the player, to gain a lot of information that we can then use regarding the decision on the pitch.
Wir sagen immer, es ist die Kombination.
We always say it's the combination of different information. It's not only the diagnostics, which of course should be the best possible, but starting off quite simply by asking the injured player the right questions. For example, did the muscle injury happen after taking a knock, or was it an injury resulting from a sprint? This leads in two completely different directions in the assessment and the treatment.
Jamal Musiala hatte an dem Tag eine
Jamal Musiala suffered a neurogenic muscle hardening that day. He came in and noticed the muscle was gradually closing up, and they know their bodies so perfectly that he then said, if I had sprinted any further, it would have torn.
Die sind natürlich von allen möglichen.
And of course, it's drilled into them from every possible quarter, also by us, that when they notice something like that, they should report it immediately and should ideally always stop.
Weil diese nicht strukturellen Verletzungen.
Because while these non-structural injuries are also injuries, they heal a lot faster than they do once the muscle has torn. We gave him a thorough examination in the dressing room.
Was man da immer mit untersucht ist.
What you always examine is the lower back and the adjacent joints. And then the physiotherapist, using manual therapy measures, tried to reduce the tone in the muscle. And then he was sent home with a compression.
Und dann wird er mit einer Kompression erst.
Rest is then also crucial, and the next day he was given a checkup.
Naja, wir sind am Ende einer sehr anstrengenden.
Well, we're at the end of a very exhausting week of preparation, often with training twice a day, and on Monday it's off to the USA. And of course, above all, we want to do everything to make sure we don't miss anything. So we're not standing there on Monday and someone isn't able to travel. That's why Jerry's in the process of scheduling who's coming tomorrow and when. But at the moment, it all looks good.
I'm in contact daily with Jochen Hanna. I don't know how often. We have a very good relationship. Of course, that has to be guaranteed, because it goes hand in hand. We take turns in roughly a weekly rhythm, and as far as I know, no or only very, very little information goes missing. That's very important.
Jamal, wie geht's?
Jamal, how are you?
Yes, it's okay.
Da hoch ist okay?
That high up is okay?
Yeah.
Eigentlich,
It's actually been getting progressively better, whereas Jamal, until recently, felt a certain tension here. So we still have to be careful with the workload. We always discuss each player in the handover. We discuss what's happened, so that actually goes hand in hand.
Ich kann das nur sagen, das ist eine einmalige.
I can only say that this is a unique collaboration and we trust each other 100%. But we also know it's important that the other one has all the information when he's back on the ground. And just like in the morning meeting, we have our meeting in the evening where we go through the players, and wherever there's something critical, we then say a few words about it.
Sagen wir dann ein paar Sätze dazu. Das wichtigste Equipment, was wir dabei
The most important equipment we have with us is, firstly, for the initial treatment of a structural orthopedic injury, but of course also of cuts and lacerations. This is what we have to treat first as soon as possible. That means we have ice with us, we have chloral ethyl spray, we have bandages soaked in ice water, so we can apply a compression at the same time. What else do we have? All kinds of Band-Aid, of course. We have a stapler in the bag, then we also have a torch in case there's a neurological or head injury, so we can look into the pupils.
in die Pupillen reinschauen können. Da muss man halt auch wirklich sehr, sehr vorsichtig sein, weil
You really have to be very, very careful there because head injuries were simply underestimated in the past, and it's known that the long-term consequences are simply much greater than it was appreciated in the past.
nicht höher einzuschätzen sind, als es in der Vergangenheit getan wurde. Naja, also wer jetzt sagen würde, der spürt ja keinen Druck, das wäre...
Well, anyone who said now that they don't feel any pressure, I think that would be a lie. But I already said, Peter and I work very, very closely together, and making these decisions together also reduces the pressure in the situation.
Wir spüren aber auch von der sportlichen
But we
Leitung,
also feel the absolute trust of the sporting management, of the coach, as well as Brazzo or Marco Nepe, which is why any external pressure is limited. But I think we also put pressure on ourselves, so it'll work out at the end of the day.
ich bin sehr stolz und sehr
I'm very proud and very happy, I must say, because I just very much enjoy working with the team. We have a terrific team in all aspects and a terrific relationship with each other. It's fun, and that wealth of experience becomes more extensive every season.
das, was man als Arzt auch dann im Laufe der
And that's what you gather over time as a doctor. You become more and more experienced, and you continue to educate yourself in this very special area of competitive sport, and that at the top level. In that respect, my level of satisfaction is very, very high.
Das Schönste am Mannschaftsarztdasein ist Teil einer solchen...
The best thing about being a team doctor is being part of a team like that, and a few people get that chance. And that's why I can just speak for myself and say it's a privilege to be able to work here every day. It was also my dream, and I'm just grateful that it's worked out.